Here's something that might shock you, and honestly, it's something most people have never been told. If you're over the age of 30 and you've noticed a new mole appearing on your skin, there's a very high chance it's not actually a mole at all. You see, in the world of dermatology, we have an important rule. It's actually quite rare, and I mean genuinely unusual, to develop a brand new mole once you've passed your 30th birthday. So what does this mean for you? It means that any new skin growth, any new spot, any new bump that appears after you've hit 30 absolutely needs to be examined by a professional. Now, before you panic, and I can see some of you reaching for your phones right now, the good news is that in most cases, these new growths turn out to be completely harmless and benign. But, and this is a crucial, but in some cases, these growths can indicate something more serious, including certain types of skin cancer. So today, I'm going to take you on a comprehensive journey through the most common skin lesion that walks through my clinic doors. We're talking about something called seborrheic keratosis. By the end of this video, you'll know exactly what these growths look like, why they appear, how to tell them apart from dangerous skin cancers, the warning signs that should send you straight to a doctor, and all the treatment options available if you decide you want them removed. Let's dive in. If this is your first time here, welcome. My name is Dr. Finbar, and I'm a dermatologist with a passion for helping people understand their skin. On this channel, we explore everything related to skin health, but we go beyond just the medical stuff. My mission is to help you learn to truly love and appreciate the skin you're in, so you can live a healthier, happier, and more joyful life. Because here's the thing, your skin is the largest organ in your body. It protects you, it tells your story, and it deserves your attention and care. Now, I want to share something personal with you. Every single day in my practice, I see patients who come in worried, anxious, sometimes even terrified because they've noticed something new on their skin. They've been lying awake at night, scrolling through Google images, convinced they have something terrible. And 9 times out of 10, when I examine them, I find myself saying, "Great news, this is a seborrheic keratosis. It's completely harmless." The relief on their faces is incredible. But here's what frustrates me. Most of these patients have been worrying for weeks, sometimes months, sometimes even years, all because they didn't know what to look for. So today, I'm going to arm you with knowledge. Knowledge is power, especially when it comes to your health. So let's start with the basics. What exactly is a seborrheic keratosis? In simple terms, a seborrheic keratosis is a benign, non-cancerous skin growth that commonly affects adults. The medical community sometimes refers to them as seborrheic warts, but don't let that word wart concern you. Unlike the viral warts you might have had as a child, the ones you could catch at the swimming pool, seborrheic keratoses are absolutely not contagious. You cannot catch them from another person, and you cannot spread them through touch. Here's something interesting. We tend to accumulate more and more of these growths as we get older. It's almost like they're little markers of the life we've lived. I've seen patients in their 70s and 80s who have dozens of them scattered across their body, and every single one is completely harmless. Now, while seborrheic keratosis can technically appear anywhere on your body, there are certain areas where they seem to prefer setting up camp. The most common locations include the face, particularly around the temples and forehead, the neck, especially the sides, the chest, very common here, the back, probably the most frequent location I see. Why these areas? We're not entirely sure, but it may have something to do with sun exposure over time and the natural aging of the skin in these regions. Here's a statistic that might surprise you. By the time most people reach their 60s, they'll have at least one seborrheic keratosis somewhere on their body. Many people will have multiple, and as I mentioned earlier, some individuals can have quite an impressive collection. I had a gentleman in my clinic recently who must have had over 100 of them. He called them his wisdom spots. I quite like that. Now we get to the really important part. How do you actually identify a seborrheic keratosis? What should you be looking for? Let me walk you through the key characteristics. First, the stuck-on appearance. This is perhaps the most distinctive feature of seborrheic keratosis. They have what we dermatologists describe as a stuck-on appearance. Imagine taking a small piece of candle wax and pressing it onto your skin. That's very similar to how these lesions look. They appear to be sitting on the skin rather than growing from within the skin. This is quite different from moles, which tend to be more integrated with the surrounding skin. Second, well-defined borders. Seborrheic keratoses typically have a very clear, well-defined edge running around their entire perimeter. You can usually see exactly where the lesion starts and where the normal skin begins. This is actually a reassuring sign. Many concerning skin lesions have irregular, poorly defined edges. Third, surface texture. The surface of a seborrheic keratosis can vary, but there are some common patterns. Waxy or greasy appearance, like they've been polished. Scaly texture, with visible flakes. Rough and dry, almost like they're crusty. Sometimes they have small bumps or pits across the surface. When I examine them with my dermatoscope, that's the magnifying device I use to look at skin lesions in detail, I can often see characteristic patterns that confirm the diagnosis. I actually find these patterns quite beautiful in a way, though I know my patients often disagree. Fourth, size variation. Seborrheic keratoses can range dramatically in size. Some are tiny, just a few millimeters across, barely noticeable. Others can grow to several centimeters in diameter, about the size of a large coin. The size alone doesn't indicate anything concerning. I've seen enormous seborrheic keratoses that are completely benign and tiny lesions that turn out to be something else entirely. Fifth, color range. Here's where it can get a bit confusing for patients. Seborrheic keratoses come in a remarkable range of colors. Skin-colored, flesh-toned, light tan, brown, dark brown, almost black. Some people have seborrheic keratoses of all different colors across their body. This color variation is one reason why people sometimes worry they might have melanoma, especially when a seborrheic keratosis is very dark. Let me share something interesting that I see quite regularly in my practice. A patient will come in, very concerned, telling me, "Doctor, my mole has suddenly become much darker." When I examine them, I often discover something unexpected. The lesion hasn't actually changed color at all. What's happened is that fake tan or self-tanning lotion has become trapped in the grooves and texture of a seborrheic keratosis. Because these lesions have a rough, textured surface, they hold onto the tanning product much more than the surrounding smooth skin. The result? A seborrheic keratosis that looks dramatically darker and more alarming than it actually is. So if you use self-tanning products and notice that certain spots on your skin seem darker afterward, don't panic immediately. It might just be this very common phenomenon. The same thing can happen with solar lentigines, those flat brown sunspots that many of us develop. The fake tan can make them stand out much more prominently. Most of the time, seborrheic keratoses don't cause any symptoms at all. They're just there, existing peacefully on your skin. However, some people do experience itching. This is probably the most common complaint. Irritation, especially if the keratosis is in a location where it rubs against clothing. Catching on jewelry or fabric, raised lesions can snag on things. In fact, irritation and itching are often the main reasons people finally decide to have their seborrheic keratosis checked out or removed. It's not that they're worried about cancer. They're just tired of that annoying spot that keeps catching on their bra strap or collar. Understanding why they develop. Now, let's talk about why these lesions develop in the first place. What causes a seborrheic keratosis to appear? The honest answer is, we don't know with complete certainty. Medical science hasn't yet pinpointed the exact mechanism that triggers these growths to form. However, we have strong evidence pointing to several contributing factors. Genetics. Seborrheic keratoses definitely run in families. If your parents or grandparents were covered in these lesions, there's a higher chance you'll develop them too. We've identified certain genetic variations that seem to increase the likelihood of developing seborrheic keratosis. So in some ways, you can thank or blame your family tree. Aging. This is perhaps the most significant factor. As we get older, our skin cells don't regenerate and regulate themselves quite as efficiently as they did when we were young. This creates opportunities for benign growths like seborrheic keratosis to develop. Think of it this way. After decades of cell division, sometimes the skin just produces a little extra, and that extra becomes a seborrheic keratosis. Sun exposure. While seborrheic keratoses are not caused by sun damage in the same way that skin cancers are, there does seem to be some connection between cumulative sun exposure and the development of these lesions. We know that seborrheic keratosis can develop from pre-existing sunspots, solar lentigines. A flat brown sunspot can, over time, become raised and develop the characteristic texture of a seborrheic keratosis. This might explain why these lesions are so commonly found on sun-exposed areas like the face, neck, and chest. Important clarification. I want to be absolutely clear about something. Seborrheic keratoses are not caused by anything you did wrong, a sign of poor hygiene, contagious in any way, a result of any infection, something you could have prevented. They're simply a natural part of skin aging for many people. Just like gray hair or wrinkles, they're markers of a life lived. The critical distinction. Now we come to what I consider the most important part of this entire video. Please pay close attention to this section. While seborrheic keratoses are completely harmless, there are skin lesions that look similar but are actually dangerous. It's absolutely essential that you know the difference, or at least know when to seek professional evaluation. The golden rule. Here's my golden rule. Any new skin lesion, any growing lesion, any lesion that bleeds, scabs, or changes should be examined by a healthcare professional who is trained in skin lesion recognition and can use a dermatoscope. Don't try to diagnose yourself from internet images. Don't assume that everything is fine. Get checked. Conditions to rule out. Let me tell you about the conditions we're trying to rule out when we examine what looks like a seborrheic keratosis. Melanoma. This is probably the condition that causes the most anxiety. Melanoma is a serious form of skin cancer that can be life-threatening if not caught early. Dark seborrheic keratosis can sometimes resemble melanoma, which is why professional examination is so important. Under the dermatoscope, these two conditions look completely different, but to the naked eye, the distinction isn't always clear. Squamous cell carcinoma. This is another type of skin cancer. One key warning sign is rapid growth. If you have a skin lesion that seems to be growing quickly, getting noticeably larger over weeks rather than months or years, this needs urgent attention. Squamous cell carcinomas can develop from pre-existing sun damage and typically appear on sun-exposed areas. Basal cell carcinoma. This is actually the most common type of skin cancer. The good news is that it very rarely spreads to other parts of the body. The bad news is that it can cause significant local damage if left untreated. Key warning signs include a lesion that scabs over, seems to heal, then scabs again. A growth with an ulcerated or crater-like center. A pearly or waxy bump. A lesion that bleeds with minimal trauma. The ABCD rule. Now I want to teach you one of the most valuable tools in skin self-examination. It's called the ABCD rule, and it helps you identify potentially dangerous moles and skin lesions. Asymmetry. Draw an imaginary line through the middle of the lesion. Do both halves look the same? A benign lesion tends to be symmetrical. Both sides are roughly mirror images of each other. A concerning lesion is often asymmetrical. One side looks different from the other. Border. Examine the edges of a lesion. Benign lesions typically have smooth, well-defined borders. Concerning lesions may have irregular, ragged, blurred, or notched edges. The border might be hard to define in some areas. C. Color. Look at the colors within the lesion. Having multiple different colors, especially combinations of brown, black, red, white, or blue, can be a warning sign. While seborrheic keratosis can have some color variation, the pattern is usually uniform. Melanomas often have chaotic, irregular color distribution. D. Diameter/different. There are two ways to think about D. First, diameter. Lesions larger than 6 millimeters, about the size of a pencil eraser, deserve extra attention, though cancers can certainly be smaller. Second, and I think this is even more important, different. Is this lesion different from all your other moles and spots? We call this the ugly duckling sign. If one lesion stands out as looking different from everything else on your body, It needs to be checked. Evolving. This might be the most important letter of all. Is the lesion changing? Evolution can include changes in size, shape, color, elevation, or symptoms, like new itching or bleeding. A seborrheic keratosis might grow slowly over years, but rapid changes over weeks or months are concerning. When to seek immediate attention? Please see a doctor promptly if you notice. A rapidly growing skin lesion changes over weeks. Any lesion that bleeds without significant injury. A lesion that repeatedly scabs and doesn't heal properly. Any skin growth that fails one or more of the ABCDE criteria. A new dark lesion that looks different from your other spots. Any skin change that just doesn't feel right to you. Trust your instincts. If something concerns you, get it checked. I would much rather see a patient with a harmless seborrheic keratosis than miss a dangerous lesion because they were too embarrassed to come in. Do you need treatment? So let's say you've had your skin lesion examined, and it's been confirmed as a seborrheic keratosis. What happens next? Here's an important point. Because seborrheic keratoses are completely benign, treatment is never medically necessary. These lesions will not turn into cancer. They won't spread to other parts of your body. They won't cause any internal health problems. This means that most healthcare systems, including the NHS here in the UK, will not provide treatment for seborrheic keratosis. They're considered a cosmetic concern, not a medical one. So treatment is really about personal choice. You might choose to have a seborrheic keratosis removed if it's in a visible location and you find it cosmetically bothersome. It keeps getting irritated or itchy. It catches on clothing or jewelry. It's in an awkward spot, like where your glasses sit. You simply don't like the look of it. All of these are valid reasons, and there's no judgment either way. Treatment methods. If you do decide to have a seborrheic keratosis removed, there are several effective methods. Cryotherapy, freezing. This is probably the most common treatment method. We use extreme cold to freeze the growth, which causes the cells to die. The treated area then forms a scab and eventually peels away, leaving fresh skin underneath. Traditionally, liquid nitrogen has been used for cryotherapy. In my clinic, I currently use a device that delivers nitrous oxide, which freezes the tissue down to -89 degrees Celsius. What to expect? The procedure takes just seconds. You'll feel a cold, stinging sensation. The area may be red and slightly swollen afterward. A scab will form and fall off over 1 to 2 weeks. Some temporary lightening or darkening of the skin is possible. Larger or thicker lesions may require multiple treatments. Curettage, scraping. For larger or thicker seborrheic keratosis, we might use a technique called curettage. This involves numbing the area with local anesthetic and injection, using a specialized tool called a curette to scrape away the growth, applying electrocautery, electrical heat, to stop any bleeding and destroy remaining cells. This method is very effective, but does require a small injection for anesthesia. Aftercare. Whatever method is used, proper aftercare is important for the best results. I always provide my patients with detailed instructions on how to care for the treated area, which typically includes keeping the area clean and dry initially, applying prescribed ointments if recommended, protecting from sun exposure during healing, not picking at scabs, let them fall off naturally. With proper care, the healing process is usually straightforward and most people are very happy with the results. So let's bring everything together. We started with a fact that surprises most people. It's unusual to develop new moles after the age of 30. This means that new skin growths in adulthood are probably not moles. They're something else entirely. In many cases, that something else is a seborrheic keratosis, a completely harmless, benign skin growth that becomes increasingly common as we age. We've learned how to identify these lesions. Their characteristic stuck-on appearance. Well-defined borders. Variable texture from waxy to rough. Colors ranging from flesh-toned to almost black. Common locations on the face, neck, chest, and back. We've discussed what causes them, primarily genetics and aging, with possible contributions from cumulative sun exposure, and we've established that they're absolutely not contagious. Most importantly, we've covered the warning signs that suggest a lesion might not be a harmless seborrheic keratosis. Rapid growth, bleeding, scabbing, and the ABCD criteria for identifying potentially dangerous skin lesions. Now, I want to mention that seborrheic keratoses are just one of many benign skin lesions that commonly appear in adulthood. In future videos, I'll be covering solar lentigines, sunspots/liver spots, cherry hemangiomas, those small red dots, dermatofibromas, firm bumps often on the legs, sebaceous hyperplasia, small yellowish bumps. Each of these has its own characteristics, and I want you to be able to recognize them all. I want to leave you with this message. Please do not assume that every new skin growth after 30 is a seborrheic keratosis. Yes, many of them will be, but the only way to know for certain is to have it properly examined. Remember the warning signs we discussed. Remember your ABCDES. And most importantly, don't be afraid to get things checked out. Early detection of skin cancer saves lives, and a quick consultation could give you complete peace of mind. Your skin has carried you through your entire life. It deserves your attention and care. If you found this video helpful, please hit that like button. It really helps other people find this information. And if you haven't already, please subscribe to the channel and hit the notification bell so you don't miss my upcoming videos on other common skin lesions. I'm also creating content about how to truly love and appreciate your skin, not just medically, but emotionally and mentally too. Because beautiful skin isn't about being flawless. It's about being healthy and feeling comfortable in your own skin. Thank you so much for watching. Take care of your skin and take care of yourselves. I'll see you in the next video. Bye for now.